because it's not just about having symptoms. Sometimes I think 60% of people who with thyroid disease don't even know that they have it.
It is June, which is Thyroid Awareness Month, and Dr. Tan and I want to set a lot of things straight. There's myths surrounding thyroid, and actually we need to begin because a lot of people don't even know what the heck the thyroid is, where it is, what it does. So let's just go to the very basics to start, and then we'll cover some myths. So showtime, Tanya.
Thank you. So the thyroid, what is it and where is it? Let's start with that. So it is a butterfly-shaped gland that sits at the base of the neck, and it is amazing in that it is involved in our metabolism, and it's involved in so many different organs in our body. So it impacts our heart, our brain development, and our bone development. It impacts our even how we think and our energy, and it's such an important gland because it can impact our ability to develop healthy follicles when we're pregnant. It can help us have good, solid energy. It's also involved in hair. So if you have an underactive thyroid, you can lose hair. Even your eyebrows can start to thin if you have an underactive thyroid, on top of being low energy and gaining weight because it's involved in metabolism. That's what a lot of people think of when they start to have a sudden weight gain. They think, I wonder if it's my thyroid. And so that is a good question to ask. It could be lifestyle impacting the thyroid, or it could be that the thyroid has gone off because it's, as you know, Mary, it goes off at different times of our life, especially, or can go off if you have a genetic history, I should say, during certain cycles of your life. So for example, if a woman is going, or a girl is going through puberty, that's a common time with that fluctuating estrogen and progesterone when she's first starting to get her period. Other times might be in perimenopause when her ovaries are starting to quieten or kind of go through the roller coaster before the quiet. And then another time, a woman's thyroid might go underactive or overactive, which we should talk about that as well, because, it can happen. So another time would be during fertility time. Even fertility treatments can impact the thyroid. We can talk more about that. And then during pregnancy is a common time when women can have all of a sudden an underactive thyroid. It has something to do with the reproductive hormones changing, which can suddenly throw off the immune system, because a large majority of the time, a woman's thyroid, if it goes underactive or overactive, it has to do with the immune system, where the immune system auto-attacks or attacks the thyroid, and then it starts to get sluggish. And sometimes you can see that there's an attack on the thyroid by your antibodies, and the thyroid hasn't actually, I guess you could say, crapped out yet or gone underactive. So
let's make it very specific to the seasons of a woman's life cycle. All right. So you mentioned that it can go off around puberty, onset of menses. And, most of the people that will listen or watch us are not at that age. So let's bring it closer in, and we'll start at the juncture of, preparing or trying to conceive, to during pregnancy, to postpartum, and perimenopause kind of time frames. All right. Because it's going to be a little different for each category. And, one of our missions is to be able to help you thrive no matter where you're at in your life's journey, from preconception to postmenopause. So this is a great time to speak to this through the thyroid. So let's start with trying to conceive, right? And then let's even bring it back to very specifically, you go to the doctor, you say, hey, I want to try to conceive. And one of the things that they have done in the past, which we need to actually sort out today, is they'll say, oh, gee, your thyroid norm is normal. There's a thyroid range, right, for the TSH.
Yes.
Right. So there's a range, and historically, and some physicians still do this, it's if it's under 2.5, then we need to supplement, because we need your thyroid to work optimally. And maybe this way it will prevent miscarriage and may actually help better with the follicle development, and it may prevent miscarriage once you miscarry. So let's speak to that. I know you have a lot to say.
Well, and it's key because it does not just prevent miscarriage if the thyroid is underactive. It also is involved in follicle development. So you want to I think it should be on every woman's prenatal screen before they decide, I'm going to, can start looking to conceive. We're going to start a family, because it's not just about having symptoms. Sometimes I think 60% of people who with thyroid disease don't even know that they have it. So it ideally would be on the prenatal screen, that with an iron on the screen, to make sure that you are in an optimal place energy wise. Like you said, we would want to be thriving, and even mood, because both low iron and an underactive thyroid can impact your energy, but also your mood.
Yeah. And so we did that episode. So if you guys haven't checked it out, go back to our episode with regards to are you tired? Do you have enough energy? Because we speak about iron, but we also bring in the piece about thyroid. So check that out, and then pop back here again too.
Totally. You and I always say this when we're having conversations. It's not just about helping women, get pregnant, but also thrive on their journey to get pregnant through pregnancy and postpartum. So if an underactive thyroid got missed, then that could mean that they might have a higher incidence of miscarriage, or they might feel fatigued through their pregnancy. And then obviously it can, as we said, it impacts brain development and bone development in the fetus. So it's really important to treat an underactive thyroid ahead of time, because of its impact on follicular development, egg development, but then also through the pregnancy, the early stages. So we're not increasing the risk of miscarriage. And it used to be, I think it still is, the opinion of some reproductive endocrinologists, that we want to keep the thyroid stimulating hormone under 2.5. And what that means is our brain makes this hormone called thyroid stimulating hormone, and it communicates and tells the thyroid to release free T3 and free T4. Those are the thyroid hormones that come from the thyroid. And it's important to look at the whole picture, because if you have a high level of thyroid hormones and maybe just a borderline production of brain stimulation saying, you know what, we want you to work a little bit more. So let's say the number is 3, but then the free T3 and free T4 are in the upper end of the range. It doesn't really make sense to treat with thyroid hormones unless the antibodies are present, perhaps, and then you would be monitoring it and treating it. But the kind of previous school of thought was that everyone with a TSH under or over 2.5 should be treated with thyroid medication. And
so, okay, let's back that up, because you mentioned testing.
Yes.
So in what you say, and this is what is, routine, people test TSH. So what you're saying and what we're teaching you all is, let's look beyond TSH. Perhaps you need to ask your doctor for more than just the TSH values. Can we get T3 and T4? And what else did you want to add in there? The
anti-TPO, so the anti-thyroid peroxidase, and anti-thyroglobulin. So the full thyroid panel to get a nice holistic perspective. And a lot of REs will do the TSH and free T4, but it's really helpful to look at the whole picture, because if the immune system is attacking the thyroid, but the thyroid stimulating hormone looks good, the message from the brain's like, you know what, I'm not going to pump out extra TSH because the thyroid's listening, but the immune system's attacking the thyroid. Eventually, while pregnant, you could develop an underactive thyroid. So the full picture is important to see whether or not you're somebody who should be monitored through pregnancy or any time in your life when there's, symptoms of an underactive thyroid.
So here's the thing, again, this is not medical advice. This is a starting off point that you can ask your primary caregiver or, other health professionals like Tanya or myself. And so because you'll get the tests, and now what? You don't know how to decipher it. So you have to go to an expert to decipher this. And, you talk about underactive, but we also need to address overactive. What's the impact of overactive thyroid?
So a person with overactive thyroid might find themselves having difficulty sleeping at night. They feel their heart racing. They might feel sweaty and hyperhidrosis, lots of, overheating. And it's kind of like, someone might think that they're perimenopausal, for example. So the hot flashes and heart racing, when really it's their thyroid. Sometimes it can have impact the eyes, a condition called exophthalmos, where the eyes are kind of pushing back or forward in the eye socket because of fatty deposits behind the eye. That can happen with hyperthyroid, or a condition called Graves' storm. Doesn't happen with everybody with an overactive thyroid. And then the inability to maintain weight. So with an underactive thyroid, you'll have a hard time losing weight often. And then with an overactive thyroid, it's can't keep the weight on. And it can, both conditions can impact fertility. And there's another antibody that we would check called TBII, in addition to the anti-TPO. And then that kind of helps doctors assess which medications might be helpful for
Graves. Yeah.
Graves, yeah.
Okay. And then how about, we might as well throw this in there. How about Hashimoto's? What is that? And what do you watch out for?
Yeah, so Hashimoto's thyroiditis is basically anytime you have itis in the word means there's inflammation. And Hashimoto's thyroiditis means that, there's a little bit of inflammation in your thyroid, and it's because the immune system, the anti-TPO and anti-TG, one or both go up, and the immune system's auto-attacking or attacking self, attacking the thyroid. And then what ends up happening with the thyroid stimulating hormone, the brain's like, okay, well, thyroid, you're not listening, so I'm going to kind of raise my voice at you. So that's why the TSH goes up. And then you'll see the T3 and T4 are often low.
And so I love that we're, addressing this clinical lab piece. And I cannot help myself and put on my Chinese medicine hat brain. Yeah. And to come in from another angle too. So, sometimes these are conditions that are inherited, right? Yes. They're intergenerational, and there's nothing that you can do. This is just the way it is. So we're going to need a little extra help.
Correct.
And then other times, some may have a predisposition, but it can actually be controlled even more naturally. And one of the things that we say, if there's when there's an itis, as you just mentioned, right, there's an inflammatory response, or the immune system is beginning to attack itself. It's we actually need to look at what has it that our body is now propelled to protect itself.
Right.
And look at our lives. What is serving me right now? What is not serving me right now? So it's not just about looking at, the right supplementation, right lifestyle, dietary piece in a physiological way, but we're also looking at how we're being in our lives, because that can also impact our physiology, right?
Yeah, I love it. I often say, and it sounds hokey, there's no evidence behind this, research, but it's the throat chakra. So I will often say, is there anything that you're feeling like you're holding back in terms of communication? Because that can sometimes impact, you're blocking the energy in that area. And I don't know if you ever feel this way, but if you're really sad and you're kind of suppressing it, you feel it in your throat. So as you know, traditional Chinese medicine, we call that the plum chi syndrome, where you
plum pit chi,
plum pit chi, right? So it's that feeling that's, in your throat. And sometimes that's, literally you're blocking your emotions and you're not comfortable with all the feels, and something like that can throw off the thyroid, that high level stress. So it's not just these different phases in your life. It could be high stress that could throw it off, or even a virus separate from that.
I love that. So then let me piggyback onto that, because in Chinese medicine's point of view, with regards to the thyroid, we actually associate it with the brain, and not the brain, the heart. And the heart, the energy of the heart is about joy. And oppositely, which is part of the same spectrum, really, it's, about sadness. So, what unexpressed, or what kind of sadness are we holding on to that we're internalizing, swallowing internally, that we don't even realize, right? Because on the outside, it's oh no, but I'm a very positive, happy person. It's oh yeah, but what are we hiding? What are we not letting out? Because over time, that holding on to that specific emotion or multiple emotions, it can impact us, and it can impact our thyroid as one of the symptoms.
Absolutely. One thing we do want to definitely mention, though, that is if your thyroid is underactive and you're doing everything perfectly, you're eating healthy and you're addressing your emotions, it's not your fault if your thyroid goes underactive and you can't get it back to normal, and you don't have to be a hero. It would be advisable to take thyroid hormone replacement if your thyroid stimulating hormones, above a certain number, for example, 4 to 5, and it's been sitting there and you're trying these things to, help heal your thyroid and deal with mental blocks and, have a healthy lifestyle, sleeping well and exercising. And if you can't get that number down or the T3 and T4 up, it's okay to medicate. And there's different types. There's 2 different types of, three different types of medications, but
yeah,
we'll talk about that next if you want.
Well, like you hit the nail on the head, and this is the most important piece of this information, really, because what I find, especially if you're coming onto our podcast, knowing that I'm a traditional Chinese medicine practitioner and Dr. Tanya Wild is a naturopathic doctor. So there's this, desire to do things all natural. Well, here's the thing, especially if you're trying to conceive like yesterday, it's like, well, if your thyroid is not working optimally, then I don't know. I don't think you want to waste your time trying to do everything naturally. It's like, let's just like go for it. Like there's a time and place for everything. And maybe this is a time to add some thyroid medication in to help you, to supplement you, to get you where you need to be. And there's nothing wrong with that. You are not a lesser human being. And just to be fully upfront, mine was suboptimal. And I did have that, oh my gosh, like, am I a loser? Like, why can't I just do it on my own? It's just like in a momentary thought, right?
Yeah.
So it's like, will I take thyroid medication? It's like, absolutely. It's like, I want this. And what's important to me, not my ego. It's like, what's going to work right now? And, my mission had always been when I entered Chinese medicine, it's like, I want to fulfill that gap, that missing link between Eastern and Western medicine. And what that meant was not just about teaching Western medical doctors about Chinese medicine, but it also meant that we literally meet halfway and look at not one medicine is omnipotent. Like it's not end all be all just with one type of medicine alone. And we live in North America. For those of you that are listening in North America or in the Western civilization, we have access. So it's like, why can't we do the best of both worlds, right?
Absolutely. So not a very expensive medication, and it can do so much. In fact, stepping aside from fertility for a moment, and then I'll share my crazy story with thyroid hormone replacement. But stepping aside from fertility, if a patient has, or, a woman's feeling exhausted and low mood, it really should be a part of the screening rather than jumping to SSRIs. Because I think that I haven't actually looked it up recently, but it used to be like number 1 or 2 in terms of prescription medications were, antidepressants. How about check the thyroid and check the iron levels first?
Right.
Make sure those are optimal. And I think it makes more sense beyond something that's going to help you within so many other ways, rather than, and then if you have to take an antidepressant, that's totally fine if it's going to change your life and help you get out of bed in the morning. But what if it's your thyroid, right? Because it's very similar. You're exhausted and can't get out of bed in the morning. It can happen. So my personal story was I was pregnant with my son, and then I had been tested at the end of my pregnancy. And I never got the results back because sadly the physician had passed away, which was a really good lesson for me to make sure I always go onto Life Labs or Gamma Dynacare, which are Ontario labs, and check my own blood work rather than waiting to get the results back.
Wow.
And then
now you can.
Yes, and now you can. Yes.
Yeah. Back in the day, I didn't have that.
No. Yeah. And then rolling into about a year later, when I was ready to try to start conceiving for number 2, we had our first miscarriage, first post our son. And I was feeling really tired and didn't understand why. And I went back to that office and found out that the thyroid was underactive in my pregnancy with our son. And that whole first year postpartum where I was like, okay, Tanya, you just got to get out of bed and go for a walk. I was so tired thinking that it was because my son's like sleep disturbances, but really I was underactive. So
wait, let me be clear. So for you didn't take meds, but it was underactive. It was not diagnosed, and you were just like living with it, suffering.
Yes. And it was an exhausting postpartum. Although I was
sad.
In this lovely, like, euphoria of finally having a child after trying for 3 years. I didn't realize, that my thyroid was underactive until I had the miscarriage. And then I went back to get that blood work and get tested to see what's wrong with me. And then I just uncovered that I still had an underactive thyroid at that point. And so then I said, oh my goodness, I'm going to hop on meds. It wasn't ridiculously, underactive, but enough that it, I think it was probably around 5 or 6. I was actually going to pull those results out to see. And then
so you went on it. So you went on it before you conceived then, the second time around?
The second time, yes.
Okay.
Thankfully.
So then let's now talk about the timeline then, right? So if it's underactive, so I was in a position where it was actually in the normal parameters, right? But in that time frame, they wanted it under 2.5. So and it was over 2.5. I think it was like 3. And so I went on it and I actually felt better, right? And because to me, it's like, let's do all the tricks. Like, well, let's optimize pregnancy. And so I did that. And I continued to stay on it during pregnancy. And, there was a little hesitation. It's like, is this like something I'll have to be on for the rest of my life? And I didn't. It was a low dose. And I kept going up to, I think, 3 months or 4 months postpartum. And how about for you? And what did you do? And then let's bring it back to generalized population.
Sure. So antibodies for me were high. Were your antibodies high?
I didn't have any antibodies.
Okay. So when your antibodies are high and the TSH is elevated and T3 and T4 are low, and this is what brought my attention to it. So I just remember when I'll finish that sentence first, but when the T3 and T4 are low, that would classify Hashimoto's thyroiditis. So I definitely jumped on treatment. I wasn't going to just try and cure myself. I did take selenium and I took gluten out of my diet. We can talk about that.
So you have Hashimoto's?
I do. But the cool thing is that when I made all those changes, the antibodies went back to normal. I didn't have, However, because I was worried about having more miscarriages, which didn't stop the miscarriages. So I don't know if it had impacted perhaps follicular development, and I had to wait on it. Eventually I did conceive our daughter naturally. And the thyroid medications perhaps helped, among other things, you never know. And I really don't know how long I had that. So, testing helps, especially again, knowing that 60% of people don't even know that they have it. So for me, then I carried on taking it through the pregnancy for baby number 2. And then I monitored, my family doctor wasn't that excited to actually check the antibodies, but I wanted to know. And my endocrinologist, she sent me to one, he had tested my antibodies, and then he said, oh, we don't retest. And I was like, and so did she. And I said, but I want to know, like, I'm doing these things to try to bring my antibodies down. And so then she reluctantly did test and they were normal. And so I thought, okay, this is exciting. But the few times that I tried to get off of the meds, I think because I had been on it for so long leading up to the pregnancy, and then after, I wasn't able to get off the meds. I'm on the lowest dose still.
Oh, so you're on it right now. Okay.
Of Synthroid. Yeah. So there's different meds. Yeah. But so when I went, I want to share something, what really brought my attention to, maybe it being the thyroid is my neck, and changed to this weird snake-like dry consistency that I had never experienced before. And my hair was starting to fall in addition to the pregnancy loss. So I was like, there's something not right.
So of course, in Chinese medicine, it's like, that's yin deficiency.
Correct. Can you deficiency, right? Yeah, totally.
We're blending East and West as we speak. Okay, cool. So, I love this podcast because, every time I learn a little bit more about you.
like, oh, Tanya, you wake up and you take thyroid meds. So yes, I do. And we have the ability as naturopathic doctors to prescribe thyroid medications. So there's Synthroid, which is free T4, basically. And something really interesting is it's bioidentical. A lot of people think that, Synthroid's not natural, but it's actually identically matches our T4 that comes from our thyroid. So
Awesome.
Yeah. So it's not like desiccated thyroid. What naturopathic doctors can prescribe is more natural. It just happens to be that comes from pig thyroid. And then it's, it's basically the match of it. And then it's T3 and T4.
So then what's the draw? Like, why would we want to do the natural one when the regular Synthroid is just as good?
That is a very good question. So for me, I considered it for me, but if I look at my blood work, my T3 compared to my T4 didn't make sense. So if for somebody has a hard time, well, first of all, let's take a step back. The T4, 80% of it comes from the thyroid, and T3, it's 20% comes from the actual thyroid. Free T3, did I say that right? Free T3, 20% of it comes from the thyroid.
Yes.
And then the rest of free T3 is converted peripherally, so outside the thyroid in our body, from free T4. If you happen to be somebody who has a hard time converting from T4 to T3, and you would see that because your blood work would show low T3, and you're taking Synthroid and you're still feeling tired, you're still having all the symptoms, perhaps hair thinning and sluggish bowel movements, constipation, difficulty losing weight, then that might be a candidate for taking desiccated thyroid, because then you get the support of the T3. In fact, if anything, Synthroid's more natural because it's relying on your body's ability to convert from T4 to T3. But if you happen to be somebody who has a hard time converting, desiccated can be very helpful.
Okay, but that takes longer.
Both.
It takes longer though, right?
No,
in terms of impact?
No, same amount of time.
Oh, okay, fine.
If anything, the thing that you have to be cautionary of, because you're taking T3, it can give side effects. So your heart rate, you might feel your heart rate beating in your chest a little bit faster. You might feel...
Sorry, I'm not following. Are you saying the desiccated or yeah, okay, got it.
Yes, because the desiccated has both T4 and T3, which is why conventional medical doctors prefer to prescribe only T4, because then it's relying on your body to convert to the T3. T3 has a very short half-life, which means like it metabolizes quickly in your body as well. So you have to be careful not to take too much of it. It goes up quickly and then down, and you might feel like heart rate elevations, insomnia, but it is very helpful for metabolism and energy if someone's still feeling that way and you look at their blood work. So it's the holistic picture. If you look at their blood work and their T3 is low, and they've tried changing their lifestyle and the T4 is not working alone, which is the Synthroid, then I would consider medicating them.
Oh, I love it. I just learned something new. And so then let's bring it, let's share that piece again, just to reiterate. So the TSH comes from the pituitary.
Yes.
Right. And it sends it. So you release that and it sends a message to the thyroid. And then it's the thyroid that produces the T4, which converts to T3. And then it gets circulated into the bloodstream.
Correct. And in the bloodstream and then peripherally, like in the cells, T3 it comes from T4, because only 20% of the T3 actually comes from the thyroid. The rest is converted in the rest of the body outside of the thyroid.
Right. You mentioned that. Yes. Okay. So that was, I forgot what piece I was.
And some people have a hard time with that. And there are vitamins that can help with that as well, like zinc, and making sure your iron is a healthy level, because that can impact the thyroid. And sometimes people will have numbers that look fairly sluggish or like low, but the antibodies are present, and they might want to wait before they treat, because once you're on it, if you've experimented and felt good on it, you'll probably be on it long term. It's hard to get off of it. If you've been on it for a while, because the thyroid becomes a little bit lazy, and it's hard to kind of kickstart it again.
Sure, because it's relying on an external source, right?
Correct.
And so I think, tell me what you think, like if you have this kind of issue, you should be followed by an endocrinologist, not 100%. Just your GP, right?
Well, it depends. I think once you're in a groove of the right medication, then you could be, brought back to your family doctor. They're very capable. If you are just starting out, you may want to, or even, as I said, naturopathic doctors are capable of prescribing safely thyroid medications and monitoring the blood work, and even working not just for thyroid replacement, but working on the immune system component as well.
So you hit another factor that is very important. It's like, well, monitoring. Well, how often should one monitor when they're trying to conceive, when they're pregnant, when they're postpartum, when it comes to thyroid levels?
So when they're trying to conceive, if they've been found to be underactive, you would want to check their blood every 6 weeks until their thyroid hormone is stable. Once they're pregnant, you would check in the first trimester and possibly 1 or 2 times, depending on symptoms in each trimester. And then you don't want to forget postpartum, because once you're not pregnant anymore, actually jump back, when you're pregnant, you often require extra thyroid medications.
Yes.
Very important to note
Yes.
that all the other hormones are impacting the need for more. So make sure you're properly followed up in that first trimester. And then postpartum, your thyroid need, the hormone replacement, is often less. So if you went on thyroid medications and didn't have high antibodies, postpartum is a nice time to wean off of it.
Right. And then, so to reiterate that, it's important to check your thyroid levels during pregnancy, because as you mentioned, the body is just doing so much more. It's like, I always say, first trimester, it's like you're doing a marathon every single day, right? You're creating lots of microcirculation to help have the embryo thrive in your womb. And then you're also at the same time creating this placenta. So it's a lot of work. So placing a lot of extra demands on your thyroid. So it's really important to get it checked during pregnancy, and then seeing if you need a higher dose. And there's nothing wrong with that. And in fact, it'll be safer for you and baby.
Absolutely. Can we talk iodine, or did you want to roll into it the next?
I love it. So let's talk iodine, and let's talk about it for our next episode. So tune in, check back next week, and we're going to discuss that, because you're going to say, what the heck? Why do I need to learn about iodine? And it has everything to do with, or there's myths around iodine. And
is it safer, and is it more natural to treat the thyroid with iodine than prescription medicine? I have a feeling you might know the answer, so come check us out and listen and hear the scoop on that.